here live from the Queen Elizabeth Central Hospital in Blantyre, Malawi, and today with us we've got Palesa Chisala. She's a general surgical consultant who works here at Queen's, mostly adult-based, and we will be speaking to Palesa about the integration of imaging, in this case point-of-care ultrasound, into her everyday clinical practice. Thank you for being with us today.
Thank you for having me.
So Palesa, would you just explain to our viewers just very concisely something about your training?
So I was trained mostly in Malawi, undergrad, postgrad, took R&D. Very short, brief experiences out of the country, but mostly I was studying here.
So next, Palesa, I wonder if you could tell our viewers, give them some insight into your experience with point-of-care ultrasound.
So first of all, I have to talk about point-of-care ultrasound.
Yeah.
This is basically when you bring the ultrasound to the patient themselves, as opposed to taking the patient to the radiology department to get the ultrasound done. So basically what happened to us is that we trained in about 3-4 month period, learning about ultrasound with a few didactic sessions, as well as actually learning with the patient. We learned some normal and some abnormal patients. So what this basically entails is that now in emergency situations, sometimes in just some acute situations, we're able to actually use ultrasound in my own personal time, whether this accident happened 2 minutes ago, hours ago, and it's just much more efficient.
Okay, and how do you use point-of-care ultrasound in your everyday clinical practice? So in a sense, how necessary or important is this to your decision-making process as a surgeon?
So this is actually pretty important. I've used it mostly in emergency situations, like I talked about the last time. So mostly in patients that have just come in with a trauma element or penetrating trauma. Sometimes I've used it in adults and pediatric patients, basically to make a decision as to whether the patient needs surgery or not, whether they're hemorrhaging out a lot or not. And with the fast scan, because you're also able to look into the chest area, I've been able to also make decisions based on that as well. So.
Okay. It's pretty important.
It's pretty important.
Yeah. And finally, can you just tell our viewers, other surgical trainees, would you encourage them to try to seek to learn the skill? How important do you think it is to integrate point-of-care ultrasound into radiology, into curricula, even for non-radiologists?
Oh, I think it's very important. When I did my training, there were 3 others that did the training, and they think it's very, very important because they use it in their day-to-day, mostly when they're on call, even sometimes when they're off call.
Okay, so it's something you would encourage people to try to learn.
Definitely.
Okay, yeah. Thanks, Palesa, for your time, and thanks for watching.
Thank you very much.